From CBS4, this is Aging Independently with Kristine Bartel, empowering seniors to live on their own terms in their own homes. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.
Hi everybody, and welcome to our show. As we age, our hearts don't always keep working the way we want them to. But having traditional open heart surgery is often very traumatic on our older bodies. Now, for at least one heart problem, there is a less invasive alternative.
Heart surgery is a huge ordeal.
Brett Tubbs has had heart problems since birth. After more than 30 years, they were starting to affect his life.
Definitely fatigue, definitely low oxygen, going up to high altitude. Snowboarding wasn't as easy as it used to be, that sort of thing, but mostly the fatigue. I mean, from walking up a flight of stairs, you could feel it pretty quick.
Last year, he started working with the facilities team at the Exempla St. Joseph Hospital complex. He was working out in the gym one day and started talking with a heart surgeon.
We got to talking about hearts, and he's a heart surgeon, so found out about the procedure, and away we went.
Dr. Kevin Miller said that Brett could have a new, less invasive valve replacement surgery.
You don't have the entire sternum break. They don't have to go in and cut that at all.
I know what a traditional scar looks like from valve replacement surgery. Can you show us yours?
The difference is from an 8 to 10 inch scar to a 2.5 inch incision.
So it was literally 24 hours post-surgery that you felt like a different man.
It was almost instant that, literally the next day I felt I could breathe deeper, I had better color. I could go on, but it was amazing.
What was your downtime after surgery?
Downtime was 6 weeks, and I was actually able to rehab and return to work.
Dr. Kevin Miller is a heart surgeon at Exempla St. Joseph Hospital. Thank you for being here. Absolutely,
it's a pleasure.
I was so excited to talk to Brett. This is an amazing procedure. Tell us about it.
It's not terribly new, although it's new to the Denver area. Over the last 3 or 4 years, I've been doing small incision surgery. I like to use the term minimal access surgery rather than minimally invasive.
Okay.
There's nothing minimally invasive about heart surgery. It
Okay.
is a huge operation, but we can do that through smaller incisions now.
Right, because traditionally, the scar goes from
usually
here
from the top of the breastbone to the bottom, or even a little bit longer, a long, 10 to 12 inch incision. As opposed to, depending on what valve we're operating on, 2-inch incision for an aortic valve here, or for a mitral valve surgery, a small incision over, it's essentially in the armpit. And it's not just valves, it's for holes in the heart, tumors in the heart, other operations that we do, we can approach the heart just the same.
And that affects recovery time.
Oh, absolutely. And that's been the major thing that I have seen with this operation. The hospital stay is about the same. Sometimes we can shave a day or two off of it. But the biggest thing is the recovery that I see in patients 2 to 4 weeks after surgery. By 2 weeks, most people are already resuming driving again, and by 3 to 4, they're already back work full-time with really no restrictions, as opposed to with a traditional sternotomy incision. These people don't even start to drive until 5 or 6 weeks after surgery, don't even start thinking about going back to work until 6 to 8 weeks out after surgery.
And we have viewers that are watching this, and they should go to the website to access your phone number.
Well, that would be one way of evaluating whether or not this is something that they'd like to pursue.
Thank you, doctor.
Absolutely, my pleasure.
Remember, you can always go to our website for more information, to take today's poll question and learn more about aging independently by watching all of our shows. Just head to cbsdenver.com and click on Aging Independently. Be sure to join us next time for more information on staying independent in your home.
Thank you for watching Aging Independently with Kristine Bartel. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.
Today's Aging Independently is also sponsored by Exempla Healthcare. For more information, call 303-318-2440.